Hello everyone, my name is Richard Chmielowski. I am a partner at PatientChase, and I'm going to give you a demonstration today of the main functionality of the PatientChase app. And I'm going to run through some of the ways that practices are using the software to manage patients with long-term conditions, in particular comorbidity patients, in a slightly different way to normal. There's been an awful lot more pickup now where people are playing catch up with COVID, sort of perhaps not in the descendancy, but there's very much more focus now of practices looking towards managing the long-term condition patients, because obviously those patients still have those conditions. They haven't been shelved or gone away. So I'm going to run through some of the main functions of the software, show you how practices are using it and how it can help you going forward. So on our website, we have a blog, patientchase.com, that's the wrong one, it's patientchase.com. On our website, we have a blog, and there we have a comprehensive guide, if you like, on practical ways that practices have adapted managing long-term condition care in the COVID-19 environment. So do take a visit there. You can download it, you can read it, you can share it amongst your colleagues. Some useful tips and resources. So do take some time to have a look at that. So I'm going to take you through the main functionality of PatientChase now. It is a desktop app. Anyone who has PatientChase has a site license, so it can be installed on any number of PCs. And it's primarily a tool used by administrators for identifying, contacting and coding patients with long-term conditions, finding patients who need to be contacted with a various number of indicators, and contacting them through different methods, which I'm going to run through with you. And obviously it's important when you make those contacts, you spend some time doing the coding, so it does detailed coding to the patient records automatically for you, and I'll touch on that as well. So the main screen looks like this. The button, this is a demo version, obviously, there's no data, it's just dummy data. The main screen looks like this. In the full version, it's not grayed out. The EMIS sync button will pull in automatically a fair amount of data for you. It will pull in all the registration details of patients, which registers they're on. It will pull in all the QoF data, so everything from GP contracts will be pulled in. And optionally, a number of our practices are now using what we call our advanced searches, which pulls in not just QoF data, but also review code data. So all the indicators from EMIS that a patient has not had a review based on those templates that clinicians complete. So there are different ways that you can use that data to target a very concise cohort of patients. So if I show you a typical search, and I'll use birth month search as a typical method because that's very popular, but you can do it by QoF targets if you prefer, or just by review codes. So the options are there for flexibility to manage them how you prefer. If I look at patients born in, let's go for April, May and June. So a number of practices because of COVID are doing catch up. So it's very easy to do a catch up rather than just focus on an individual month. So if I look at 3 months, I'm now going to pick the registers. So I'm bringing in patients born in April, May or June across the following registers, and the registers that you can pick are entirely up to you. So you may pick one register and focus on that. You may pick two, for example, COPD and asthma, or you might wish to pick all of them. It's really up to you. Every practice is different. So in this example, I'm just going to pick a whole host of registers. So let's throw that in. So the more registers you pick, the more cross-referencing PatientChase will do, and therefore identify those complex patients that might appear on multiple registers. And in every practice, there are many of those patients. So in this example, we have got 246 patients who are born in April, May or June who appear on any number of those registers. So if we have a look at who those patients are, we'll call this April, June, month of birth. When I click on finish search, so you can see selecting the registers is very easy. When I click on finish search, it presents the complex comorbidity patients in an easy to understand way. So if I draw your attention to this column, date of birth, remember I picked patients born in April, May and June, so that's all you're seeing in here. There's your long list of patients. Across the top are the registers that I handpicked. So each row is a patient, and for each patient it tells you which registers apply to that patient. So people at the top are the most complex, on the most registers. So this patient is on CHD, heart failure, hypertension, diabetes and asthma. That patient, heart failure, hypertension, CKD and AF. Complete mixed range, you're going to get that in every single practice. Now, rather than trawl 246 patient records to see whether those patients have been in or not, because some of those will have come in opportunistically, some would have been targeted already, we're going to get the software in a matter of moments to highlight within this list those patients that have outstanding key indicators. And as I touched on before, you can decide whether those key indicators are QoF targets or whether they are review codes. So whether a patient has had the review code done record, read code put into their records, or a combination of the two. The search I'm going to use, which is a target search, has got a combination of the two. So I'm building that now. It's a pre-built search, so the practice will have a pre-built search where it defines the key indicators that matter to the practice that identify whether patients have been in or not. So you don't have to keep running each time. And once you've built your birth month search, which we've done, you then build your key indicator search, and then you marry the two up. And when you do that, it will perform a cross-reference and highlight within your list, your birth month list, those that you need to contact. So to do the cross-reference, I'm just going to drag my birth month into the target search. So do you want to cross-reference? Say yes. And then we wait a moment. And it jumps back into your birth month list. Remember, you can do it by QoF or review codes only without birth month filtering. It's entirely up to you. This is something we help you with when we set the software up. In the example I've picked, which is not very representative because it's dummy data, so no one's been in, because it's made up data. Out of the 246 patients that were born in April to June, the software found that there were 244 that still needed targeting. And it's highlighted those key patients in blue. So in a non-representative example, it's only found that 2 people have been seen. In a realistic practice setting, even with COVID, we are finding that a large number of patients aren't coming off because they have been addressed since the outbreak began, and certainly since the 1st of April. So in this non-representative example, there's just 2 patients have been seen, 1 patient for asthma, 1 for mental health. All the others still need targeting, so we're going to keep those on. So remove the people that have been seen. And then it's a case of contacting the patients. Quite often there's another option here that practices follow, and that is filtering out from this list housebounds or nursing home or care homes, either removing them or identifying them separately. So that's also very easy to do through the software, and it's a common approach for practices. So once you've got your search down, you've got a very concise cohort of patients. They're all born in a certain month if you're doing it by birth month or months. They all appear on one or more of the hand-picked registers that you've selected. You've filtered out the patients who've been seen, and you've filtered out optionally housebounds, care home and nursing homes. And then it's a case of contacting the patients in your preferred method or methods. There are 4 ways through PatientChase of looking at contacting patients. Each practice is different. Some use one method as a primary, others use another method. I'll touch on all of them. Letters. So if we look at sending letters to patients, this option will generate personalised invites. The algorithms of the software will identify what the patients need to be targeted for, and it will put very detailed coding, read code and SNOMED coding back into the patient records that they've been contacted for their different conditions. So if we look at what the letters look like, there are no export limits. So if you want to do everyone in the search, no problem at all. So it doesn't matter how big your search is, you can do all of them. If you'd rather do a smaller batch, then you can do that, and the software will remember where you got to. So when you come back to do another batch, it will carry on where you left off from. You then pick a letter that you want to merge to. It's very easy to customize our sample templates with your own practice information, which is obviously important. You want to be able to have a letter that looks exactly how you want it looking from your practice, with your header, your footer, your logo. They're just simple Word documents, so it's very easy to customize the template. It's also very easy to add and remove merge fields. So if you are used to having an invite, and again, when I come up touch on emailing, this is what the email will look like. There's detail on the letter or email for each patient. It addresses them. It also identifies which conditions they have specific to the patient. So the algorithms are identifying just the things that apply to that patient. On my template, I included which bloods they need as well. You can include that or exclude that. Some of our practices remove any condition identifiable data and simply say, dear patient, you're due your annual review. So how much information you supply to the patient is entirely up to you. The more information you supply, the better educated your patients. The more information you supply, in this example that I used, it helps the receptionist identify how the patient needs to be booked in and for how long. Now, in the example so these are statements that apply for each condition. It's very easy to customize them in the central setup of the software. So if you prefer to refer to CHD as instead of heart-related condition, CHD or angina, that's fine. And you can see I've automatically put in a time and a clinician who needs to be booked in with and for how long. With a COVID environment, if you would rather put in extra information, for example, hypertensive patients, how they can take their own blood pressure readings and how they can submit them to the practice, you can provide a link along there. If you'd like to put in some information about asthma patients, how they can better self-manage at home, you could put a link in next to the asthma statement. So think about the software doing the hard work and personalizing the invite and addressing the patient with the information you want to supply to them for each condition. So quick look at this patient. They've got those 5 conditions. This patient has 5 also, but 5 different conditions. So this one's got diabetes and asthma, whereas this one didn't have either. And then further down the list you go, you'll have patients on fewer registers. So this one's on 4 registers. So whilst, you know, letters are great for educating the patients, they're also good for sending out information about self-management if possible. And that applies for emails because this is what the email will look like. We'll come over to emails now. So we used letters as the method of contact, and that's what the detailed coding would go in the records, that they were contacted by letter. For each condition you call in MIN for, the software knows which read code / SNOMED code should go into their records, and the software is clever enough to determine whether it should be entering first, second, or third if you're still using that invite into the patient records. If I switch on email and select export to email, the software has the NHS Mail gateway built into it. So you know that generic NHSnet email address you have for the practice. You plumb it into the setup of the software, and then you can email the patients in the list. Those that have an email address can be contacted with a personalized invite or a personalized message for each condition you're calling them in for. And then the software will code into their records they were contacted by email. If I switch on texting, you can export the results to texting, which means you can SMS the patients with your generic NHSnet email address directly through PatientChase. Obviously, that message will be shorter because you can't get so much on a text message, but there is the function to contact them through PatientChase directly, and also it will code into their records the detailed codes that they've been contacted by SMS. If I switch on telephone, you can then print this list to Excel as you can any search. So if I export this list to Excel, if it'll let me do that. So that puts the data set into Excel. Let's see if we can display that. There we go. And then you can then hand that to a colleague who can then telephone the patients up. So if you would rather telephone patients to make virtual appointments with the doctors and nurses, you can use this list because it's got the telephone numbers and mobiles in the live version. And then once you have contacted those patients by telephone, which is a very popular method at the moment because of COVID, you can then insert those into EMIS. That will put a code into the records, batch code for all the different conditions that you've contacted the patients for. So you can highlight them, say, right, I've contacted that one, that one, that one, that one by phone, and then it will code specifically that you've contacted those patients by telephone into their records. So there are different ways of contacting patients through the software, and the software gives you options of identifying very specific cohorts of patients that you wish to contact, depending on the particular requirements of the practice. That's obviously easily determined with a quick chat when we set you up. So we make sure we show you training based around the recall that you want to work, rather than forcing you to go down a different route. And it's a tool that's been used for 14 years now. We've got over 500 practices at the moment, so it's a very popular product. Thank you for your time. I know Jamie's going to filter some questions and forward them to me, so we'll do our best to get those questions answered that haven't been today.